It is estimated that 125,000 children and adolescents in our state have mental health conditions, and only half of these children are receiving treatment. Joining me now is Ben Rodriguez, the program officer for Connecticut Health Foundation, and Pastor Mitchell Wynn with the Mental Health Initiative in Middletown to tell us more. Thank you, gentlemen, for joining us.
Thank you, Jocelyn.
First of all, let's talk about the overall problem with mental illness in children here in Connecticut. Are we seeing an increased number?
Well, I think there's a lot more awareness of the issue of mental health for adults and children. You mentioned the statistic that 125,000 children in Connecticut are estimated to have unmet behavioral health need. I think we know that there are systems that are not capturing or identifying these children. We're identifying these children when these issues are severe, when they require hospitalization, or when they enter the juvenile justice system. And we're hoping to place emphasis on practices and systems that can identify children when they're exhibiting signs age 6 to 14 before they really require that deep end support.
You actually see symptoms at age 6 or younger, don't you?
A lot of research is showing us that signs of various behavioral health issues are actually exhibited during that age bracket, that the 6 to 14 are in that middle school age as well.
Very good. Pastor, when you have the program Mental Health Initiative in Middletown, how young are the kids you're treating?
Actually, I have witnessed even as young as the age 5 years old myself, working with kids there. And it's amazing how young, they are before they start to pick up this mental health issues there and disorders.
What kind of programs do you offer kids and their families?
Well, it's a variety of programs. We're into like Park and Rec has a program, and the schools also have done some screening, and they have set up resources within the school. They have set up a team, or a group that we work with within the school to monitor the kids and work with the kids from there.
So are you talking about therapists, experts like psychologists?
Yes, exactly.
And those are very difficult to get that type of treatment, though, isn't it, Ben?
Well, the initiative itself is focusing on preventive supports, interventions and supports for children and families as they're exhibiting signs. So it may not necessarily be treatment, but it does involve the systems that intersect with the children, the school systems, the behavioral health systems, the faith-based systems as well, in Middletown in particular. And these communities are coming together to develop a system that will identify children as they're exhibiting signs and be able to provide those supports long before they require hospitalization or enter the juvenile justice system.
But what's disturbing is that only half of these kids are getting treatment.
That's the reason for the initiative, that we feel it's so important. Once a child enters the juvenile justice system, or once a child enters or goes into the emergency department, we know that there's supports available. We're trying, and that's the way the systems are set up right now. We're trying to set up a preventive system.
And I also think the reason why a lot of the numbers are down is because a lot of people have historically been avoiding, the fact that mental health is within their families. And so with this collaborative coming together through the Connecticut Health Foundation and these resources that we're putting together is making it more of a visual now, and talking with parents and getting them to intervene within their children and their behavior. So they're beginning to come out more now and supporting the resources that we put in place.
So your program is faith-based. So what do you say to parents to get them to bring their children in?
Very good question. The faith-based, well, the Middlesex Hospital and the schools and faith-based have come together, and the faith-based is more of the bridging the gap to bring the trust. The schools have set up, as I said earlier, have set up support groups inside the school. But the faith-based come in and bring the trust factor to where we will no longer work in isolation. So we come together now, and we're actually, birthing this new child now to be raised up to learn about the mental health illness that's in the families. And it's really working well.
Another example that it takes a village to really raise a child.
Yes.
Now, Ben, Is the challenge here to find more funding so that we have more programs like what Pastor Wynn has in Middletown?
Well, there's always a number of challenges, but first and foremost is being able to identify systems that can intersect with a child, that can integrate these policies and procedures to work with children and their families, and establish the trust that Pastor Wynn was just talking about, so that the culture can be to identify issues long before they become acute.
Very good. If you want more information on the Connecticut Health Foundation, all the information is right there on the screen, or just come to our website and we'll have that link for you.